So the scenario that I chose was the fifth one, and this is me being a therapist at a hockey game. An athlete slides into the boards and stays down, grabbing their right wrist and right knee. So what I'm going to do is perform all wrist functionals, as well as medial collateral ligament test and meniscus test. So what we're going to start off with is asking for permission. My name is Shabnam. What's yours?
Sophia.
And where have you injured?
My right wrist and my right knee.
Okay. Am I allowed to perform tests on them?
Yes.
Okay, so what we're going to start with is an active range of motion test, and this will test for your willingness to move, as well as pain level and your contractile structures. So can I have your arms out like this? And what we're going to start with is flexion. So can you bring your fingers towards yourself? Okay. Does this hurt?
No.
Okay, I'll ask you to relax. And next is going to pronate your hands and bring it towards yourself again. This is for extension. Do you feel any pain?
No.
Okay, you can relax your hands. Next, I'm going to ask you to supinate once again and bring your pinky fingers towards each other, and this is looking for radial deviation. Okay, it looks like a good bilateral range of motion. And now I'm going to ask you to relax and bring your thumbs away from each other for ulnar deviation. Okay, perfect. Did you feel any pain?
No.
Okay, next one we're going to do is passive range of motion. For this I'm going to be testing the non-contractile structures, and we're going to look for pain and end field. So have your hands in pronate. I'm going to start with the non-injured side. Okay, for flexion, I'm going to hold on to her wrist and on her hands, and I'm going to flex her wrist for her. Do you feel any pain?
No.
Okay, next I'm going to ask you to pronate your hand, and I'm going to hold on to your wrist, hold on to her hand, and extend it for her. Do you feel any pain?
No.
Okay, next one I'm going to ask is back to supination. And I'm going to do radial deviation, which is bringing the hand medially rotating it. Do you feel any pain?
No.
Okay, and I'm going to do the same for ulnar deviation. I'm going to laterally rotate it. Adductor. Okay, did you feel any pain for that?
No.
I'm going to do the same thing on this side. And I'm going to ask you to hold your hand out, and I'm going to flex her hand. Do you feel any pain?
No.
Can I ask you pronate? And with that, I felt a tissue stretch, as well as a capsular end field. And then you hold onto the wrist and the hand, and what you're going to do is extend it, and for this I feel a tissue stretch as well as a bony end field. Next I'm going to ask you to supinate again, and for this I'm going to hold onto the wrist, onto the hand, and radial deviate, which is adducting, and for this I also feel a tissue stretch, and I'm going to, did you feel any pain? I'm going to hold onto the wrist again, hold onto the hand, and ulnar deviation, which is abducting. Do you feel any pain?
No.
And as well as this, I feel kind of a bony end field. Next, we're going to do the resisted range of motion. With this, we're going to be testing the strength of the contractile structures, as well as pain level. So 5 out of 5 being full strength of the individual. So we're going to start again once with the non-injured hand. And what I'm going to do is ask you to supinate. And you're going to try to push upwards. And I'm going to hold your hand, and you have to try to resist my pressure, okay? So 1, 2, 3, 4, 5. Did you feel any pain? Okay, that was 5 out of 5. Now we're going to pronate the hand, hold on to it, and then you're going to push upwards again. Ready? 1, 2, 3, 4, 5. Any pain? Okay, that was 5 out of 5. Next, I'm going to check for ulnar and radial deviation by holding onto them like a handshake. And they're going to, for the ulnar radiation, they're going to bring it upwards, push upwards, and I'm going to try to push down. Ready? 1, 2, 3, 4, 5. Feel any pain? Okay, now you're going to try to push downwards, and I'm going to push upwards for the radial deviation. Ready? 1, 2, 3, 4, 5. Feel any pain? Okay, 5 out of 5 for both ranges. And we're going to do the same thing on the side. Okay, you're going to push upwards, and you're trying to resist that me, okay? 1, 2, 3, 4, 5. Any pain? Okay, 5 out of 5. I'm going to push upwards. 1, 2, 3, 4, 5. Any pain? 5 out of 5. And then now we're going to do the handshake one. You're going to push up, and I'll push down. 1, 2, 3, 4, 5. And then you push down, and I'll push up. 1, 2, 3, 4, 5. And that is all the wrist functionals. So the next test I'm going to be performing is the medial collateral ligament test. And what I'm going to start with is the non-injured leg. I'm going to hold on to the inner thigh and her ankle, and I'm going to laterally rotate her leg, her knee I mean, and this is to open the medial side, and then I'm going to abduct at the same time. Do you feel any pain?
No.
Okay. We're going to do the same thing for her injured side, and this is to view the deep fibers. So once again, hold on to the thigh, laterally rotate, and abduct. Do you feel any pain?
No.
Okay. Next, I'm going to do it at a 30 degrees, and this is to see the superficial fibers. Okay, I'm going to put a pillow underneath her to bring her up to 30 degrees, and you're going to do the same thing. Essentially, you're going to hold on to her leg, her inner thigh, laterally rotate, and abduct. Any pain?
No.
Okay, same thing on this leg. Put the pillow here. Okay, hold on to the inner thigh. Any pain?
No.
And the Enfield feels okay, and she has no pain or any. So the last test that I'm going to be performing is for the meniscus of the knee, and the test that I'll be using is the Apley's compression test. So what you're going to do is have your patient lie on their stomach, and you're going to ask them to bring up their leg to a 90 degrees angle, which is like this, okay? And you're going to hold on to the calcaneus, and you're going to add pressure down towards the tibia. And once you do this, you hold on to the back of their leg, and you're going to medially and laterally rotate the leg. Do you feel any pain?
No.
Okay. And for this, if you hear any clicking or any sounds, that means there's most likely an injury as well as pain. We're going to do the same thing with the injured knee. We're going to hold on to the calcaneus, push down on the tibia, and hold on either to the back or the back of the thigh. And what you're going to do is medially rotate and laterally rotate. Did you feel any pain?
No.
Okay. That means she has not injured her knee or her wrist. To answer the questions, how is the medial collateral ligament structurally different from the lateral collateral ligament? When looking at the medially collateral ligament, the MCL, it is more longer and thinner than the LCL. This difference and the placement of where these ligaments are does have an effect on the other structures that are injured. For instance, for the medial collateral ligament, it is on the tibia side, so if you injure that, you most likely will injure your tibia, where your LCL, you are having, that's on the lateral, and that's going to be on the fibula side, and that side is going to be more affected when injured.